Hey everyone, welcome to the Autoimmune Dietitian YouTube channel. My name is Annie Rubin. I'm a registered dietitian and I work with people struggling with autoimmune diseases. And when I work with my clients, I use both food and lifestyle as a way to improve their health, their symptoms, and to hopefully help them live the lives that they want to live. So today we are talking about autoimmune diseases in general. And the reason why I decided to, kind of bring it back to the basics is because when I was diagnosed with rheumatoid arthritis in 2008, I remember my doctor telling me that I would be okay as long as I kept my disease under control. But they didn't tell me much more than that. For years, I kept my diagnosis a secret. Even my closest friends had no idea what I was going through. And to be honest, I was in denial for a really long time. I never bothered to understand what exactly was happening in my body. I just kind of accepted that I had this condition and the medication I was taking worked, and I didn't need to do anything else until fast forward about 10, 15 years when I had kids and things started to go downhill pretty quickly after that. I realized that I needed to do something in order to improve my disease, and that's when nutrition and lifestyle started playing a big role in my healing journey. So today we are going to cover what autoimmune diseases are, what's happening in your immune system, and a few statistics about autoimmune diseases so you don't feel so alone in this, living with this condition, because a lot of people do have it and are living gracefully with it too. So before I jump in, I just need to attach my usual disclaimer to this video that the information in today's talk is not the substitute for the diagnosis, treatment, or care of disease by a medical provider. This is for informational purposes only. So please consult your qualified health professional for any changes you make to your medical care. Okay, so what are autoimmune diseases? Autoimmune diseases occur when your immune system attacks healthy cells, tissues, and or organs in your body. Under normal conditions, your immune system only attacks invaders, such as bacteria, viruses, infections, and so forth. And your immune system can usually tell the difference between yourself and your non-self, with the exception of some cells called lymphocytes. Everyone has these lymphocytes, and sometimes these lymphocytes react against ourself and cause an autoimmune reaction. However, in healthy people, these lymphocytes are suppressed so they don't cause any damage. In autoimmune diseases, either the lymphocytes are not fully suppressed or the body tissue changes and is seen as an invader or non-self by the immune system, which then triggers an attack. So the medical world likes to categorize autoimmune diseases into two different types: organ-specific and non-organ specific. Some diseases fit neatly into these categories while others fall somewhere in the middle. Organ autoimmune diseases is where one organ is attacked. For instance, Hashimoto's and Graves is where your thyroid gland is attacked. Addison's disease is when your adrenal gland is attacked. Type 1 diabetes is your pancreas. Celiac is where your small intestine is damaged, and so forth. So non-organ is where the immune system attacks are more widespread, such as rheumatoid arthritis, where it attacks various different joints and synovial fluids. Lupus, which can attack both joints and multiple organs, and MS, or multiple sclerosis, which attacks your nervous system. So what is really going on in your immune system that it decides to mount an attack on your body? So autoimmune and the dysregulation of the immune system happens in the adaptive part of your immune system, not the innate part, which is the more responsive autoimmune system. Adaptive is where your acquired immunity lives. And there's two different types of cells that live in your adaptive immune system. There are T lymphocytes and B lymphocytes. So T lymphocytes, or T cells, secrete cytokines to trigger immune responses, and they are also your regulatory cells, or micromanagers of your immune system. They differentiate into more specific types, but that's more detail than we need to get into right now. And then you have the B cells, or the B lymphocytes, which are the cells that make the more specific antibodies. So now let's talk about the immune system. Your lymphocytes are created in your bone marrow and thymus and create what is called a central tolerance. This helps shape your immune system and keeps it balanced. Then you have something called peripheral tolerance, and that's like your body's policing system. Any T cells that your body creates that happen to be self-reactive are typically destroyed by this peripheral tolerance. B cells also help regulate this peripheral tolerance. However, there are some T and B cells that are autoreactive or self-reactive that can leak out into circulation. And in fact, what's super interesting that everyone has autoreactive T and B cells floating around their bodies. But here's the difference. People can have a physiological autoimmunity where you have these autoreactive T and B cells that cause no damage. They're floating around, but nothing is really happening inside your body. On the other hand, you can have pathological autoimmunity that is triggered by genetics and or environmental factors where your immune system becomes dysregulated. And this is when you see tissue and organ damage or an active autoimmune disease. This active autoimmune disease happens when either the T cells are overreactive or the T regulatory cells are not active enough. You can also have autoantibody production where your body starts making antibodies against its own tissues, and that produces an attack on a cell or protein in your body. So the immune system is super complicated, lots of moving parts, but just know that when you're having an autoimmune reaction and you are diagnosed with an autoimmune disease and your disease is active, it is either because your T cells are overreactive or your T regulatory cells are not active enough. So here are some fun statistics about autoimmune diseases. There are approximately 50 million people in the United States with an autoimmune disease, and that statistic is on the rise because many times it takes years to get diagnosed. And it's not always apparent when someone has an autoimmune disease. So there are a lot of people who are living right now who probably aren't diagnosed with something, but are starting to feel symptoms and they think something wrong is happening in their body, but unclear what that exactly is. 80% or more of those people with autoimmune diseases are women. Autoimmune diseases are also known as a cluster disease, so they occur in clusters. 25% of people with an autoimmune disease have at least 3 or more, but have at least 3 of them. So 3 different types of autoimmune diseases. It takes an average of 4 years to get a diagnosis, and 45% of patients were told they were chronic complainers in the early stages of their illness. Also due to the fact that most, like I said, 80% of autoimmune disease patients are women. Women tend to be gaslighted a lot in the medical community and aren't listened to. So that is another that adds to kind of the delay in diagnosis for a lot of people with autoimmune diseases. So just to recap, today we focused on what autoimmune diseases are, how it's related to your immune system, what exactly is happening in your immune system that it's starting to attack your own body, and then some interesting statistics about autoimmune diseases. So thank you so much for joining me. If you don't follow me on YouTube, please hit the little subscribe button. These videos come out about every week. Always trying to give you lots of information of how to live gracefully with your autoimmune disease. If you would like more help managing your autoimmune disease, please go to my profile. There should be a link there to schedule a free discovery call with me, just to learn about my services and to see if I'm a good fit for you. Lastly, I do have group programs that are offered sporadically throughout the year. It is January 2025. My next group program starts very soon. If you're interested in that, please go to my website under services and look under my foundations program for my Ditch Your Inflammation program. You can also sign up for my newsletter. It comes out every week, trying to give you lots of information about how to live, again, with your autoimmune disease, give you lots of tips and tricks. Thank you for joining me. I truly appreciate it, and I will see you next time.